Hi, I'm Dr. Laura Robin again, and here is another video with some more really great information. Today, I'm going to talk about the standard American diet, which I'll also refer to as SAD or the SAD diet. Why is SAD so sad? Well, SAD is one of the saddest things that's ever happened in this country. Another SAD thing is that most people who are eating the SAD diet don't even know they should be sad. It represents the daily food choices of most Americans. We wonder why we're in the middle of epidemics of obesity and heart disease and stroke and dementia, autoimmune disease, degenerative diseases, cancer. And we wonder why the vast majority of middle-aged Americans are tired. They're stressed out. They're not sleeping. They have low libido, low mood, irritability, heartburn, skin issues, chronic pain, achiness. And we wonder why so many of our esteemed elders are spending their last 10 to 20 years in assisted living facilities because their health is so bad that they can no longer care for themselves. And we wonder why this new COVID-19 virus, which devastates people with underlying conditions, has been so incredibly devastating to Americans. So let's talk about SAD, the standard American diet. This way of eating started in the US in the 1950s, along with the industrialization of the food industry. According to the US Department of Agriculture, 57% of the average American diet comes from processed foods, and 32% comes from animal products. That leaves only 11% that comes from vegetables, fruits, whole grains, legumes, nuts, and seeds. Ouch! 11%, only 11%. In short, the standard American diet is nutrient poor, and worse, high in sugar, refined carbohydrates, saturated in trans fats, inflammatory foods and additives, low in nutrient dense and high fiber foods. The standard American diet gives Americans way too much of what they don't need and what can harm them, and way too little of what their bodies need to maintain their health. SAD is a perfect recipe for obesity and inflammation. It's the main engine behind type 2 diabetes and heart disease and stroke. It's a major contributor to most chronic illnesses. The research is clear. Our bodies need the right fuel to get the job done, to support our bodies so that we can live our lives as we desire. You may be hearing about this and saying to yourself, well, I'm not that bad. Well, hopefully you're right. Even if you're not eating as poorly as the average American, it's time to take a really good look, a hard look at where you do stand. Is your body getting what it needs? Are you taking in too much of what challenges it? Could it be that making some changes might be in your best interest? Everybody is different. Everybody has different needs. Even so, every single body benefits from saying goodbye to the standard American diet. I want to just say a few things about the Medical Symptom Questionnaire. In your Total Health Reset, we have placed a Medical Symptom Questionnaire for you to answer periodically. I'd love you to answer it at the very beginning of your program and also at the end. Nobody exactly knows who developed the Medical Symptom Questionnaire, but it has become a gold standard in the functional medicine industry for clinicians to be able to help their patients to get a good subjective and objective view of how that patient is doing at any particular time. It's an ability to do a little snapshot of where you are in that particular moment, because a lot of us aren't really able to follow or grok the changes that we've made when we're making slower change. It gives us a chance to be able to quantify how we're feeling. And then we can add up all those numbers and we can have an idea of how we are doing in the moment. Taking this questionnaire every few weeks, especially when you're making major changes in your food and your lifestyle and all kinds of other things, it's a really good way to be able to monitor your progress. We can also monitor your progress through lab tests, and there are other objective tests that we can use. But for you to really see how your symptoms are changing, I really urge you to do this medical symptom questionnaire. It only takes just a few minutes. While I'm on the subject of medical symptom questionnaire and keeping track of your symptoms, I always do also recommend that you do keep a journal, that every day to few days you journal about how you're feeling and what's up for you, what's not working for you, what is working for you. Because as we go day by day, we're making lots of different changes. And sometimes it's not until we go back and we review what we've done and how that relates to how we end up feeling a few days later, a few weeks later. It's until we are able to go back and review that we actually really learn the deep, most important things. So I urge you to not only do your medical symptom questionnaire, but also keep track of your day-to-day. It's a real gift for yourself to keep a journal every day.